All right, we're going to go ahead and get started here today. So just a little introduction if you weren't here with me last week. My name's Christina. I'm one of the therapists here at M3. This is class 2 of our beginner's low back course. So last week we talked about core strength and glute strength, and we progressed from a really basic exercise. We did some abdominal bracing, we did some bridging, and we progressed those exercises to a little bit more advanced. And I want to remind you, same thing for this session, listen to your body. So if something hurts or makes your pain worse, don't do it. You can modify it as we progress the exercises and you recall maybe a more basic form that we have talked about. Do that instead. I don't want you to cause further injury, and it's really important, especially with the spine, that we pay attention to pain and we don't push into that pain or cause further damage. The spine is tricky. It's irritable a lot of times and it takes patience. So listen to your body, and same goes for you, Brett. Brett's gonna be helping me out here today. So we're gonna progress from the exercises we did last week. So if you didn't join us last week or you need a refresher, feel free to watch that recording and kind of review some of those exercises. We're gonna start today with a little bit more core activation. Last week we started on your back. This week we're gonna start on hands and knees. Now Brett has like a little foam pad, it's black, so you probably can't see it that well here. But this is helpful for you if you have a yoga mat or do it on carpet, something that's a little softer on the knees. So he's gonna get in this position here. His hands are directly below his shoulders, his knees are directly below his hips, and his back is flat. So you don't want a big curve here at the spine, you want it pretty flat. And what he's gonna do in this position is pull his belly button up towards his spine and get that same abdominal contraction that we worked on last week. So without moving the back, he's lifting his belly button, pulling it up towards his spine and contracting his deep abdominal muscles. So I want you to hold that for a count of 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now relax the abdominals. The spine stays still. The spine isn't relaxed. Okay, and I want you to pull those abdominals up and in towards the spine again. So this is called an abdominal brace. We did this last week. We just did it in a different position. And sometimes in this position, it's a little bit easier to feel that belly button lift up towards the spine. So holding here about 3 more seconds and relax. So now what Brett is going to do is pull that belly button up and in, just like we were practicing. He's gonna hold that position tight, and he's gonna extend one arm out straight towards his head and put it back down, and then the other arm. Good, so we're gonna alternate just like this, back and forth with just the arms first to get the hang of it. So if you see his spine here, he's rock solid. He's not moving at all. His abs are tight. He's just moving the arms. This is really important for daily activities, that you're able to move the arms in space while keeping your abdominals tight. Few more repetitions of just the arms. You should be feeling your abdominals work. It looks like an easy exercise, but it can be deceptive. It can be harder than it looks. All right, relax the arms. Keep that abdominal brace nice and tight. Now what Brett is going to do is extend one arm and the opposite leg, and it'll kick back and then come down and then alternate again. Opposite arm and leg. So this takes a little bit of coordination. Okay, it's really important that you keep your abdominals tight and don't let the back arch at all. Good. Good. So Brett's getting a little bit more of an arch when he extends the right leg versus the left. That's common to have some asymmetries. Just really focus on pulling that belly button up and in. Now you may not be able to extend the leg as far out as Brett is extending the leg, because maybe when you do, you get too much motion in the back or it's painful. That's okay, just don't kick it out as far. Just small and controlled movements is what we want here. So we're gonna keep going on this exercise. I like to do it for about 1 to 2 minutes. So it works on balance and coordination as well as abdominal strength. Very good. One more on each side. Last one. Very good. Take a little break. So that was an exercise to kind of warm up our core musculature. We're going to go next to something that we practiced last week, which are called the marches. So he'll go ahead and flip onto his back. You can do this as well. All right. So while on your back, you're going to relax the head and neck. I want you to get that abdominal brace. So pull that belly button down and in towards the spine, just like you had it. It should be nice and tight. And you can even put your hand on the side. I don't remember if we talked about this last week or not, but right above the pelvic bone on the side here, you can put your hand. Go ahead and relax, Brett. When you're relaxed, you shouldn't be able to feel any muscle tightness. And when you pull that belly button down and in and contract your abdominals, you should feel it tighten with your hands. Okay, so I want you to get that abdominal brace nice and tight. One leg at a time, you're gonna lift it up to 90 degrees. Keep that brace really tight and lift the second leg up and hold it. From this position, Brett is going to march with his feet down towards the mat and back up. You're gonna keep that 90 degrees though, Brett. Yep, so keep one leg up at 90 and you'll alternate back and forth. Now, if this is too difficult, you can keep one leg on the mat and just bring one leg at a time up and down, alternating sides, okay? So I'm gonna have Brett keep both legs up though. And then tap, yes. So this is called a core march. It's a little bit more progressed than what we did last week. And these are really hard. So I would do about 10 reps. You've probably done 10. Bring one leg down, then the other, and then relax the abdominals. You don't want to relax your abdominals until both legs are down on the mat because it strains your back a little bit and causes those extensor muscles to kick in. So keep your abdominals tight until the legs are relaxed. Let's do that one again. So Brett's going to lift one leg up to 90 and then the second leg, and he's going to march. And remember, to adapt it, one leg is going to stay on the mat the whole time so that you don't have both legs up at the same time, okay? So his back is very flat against the table. If you feel any arching at all in the low back, you may need to go down a level and keep one foot on the mat until you can be strong enough to keep your back flat the whole time. Good, go ahead and relax one leg down, keep that brace, and then the other. And relax the abdominals. We're going to do one more set of those core marches. So get that abdominal brace, one leg comes up, then the other, and march. That's it. I like that modification, Allison. That looks really good. You should be feeling your abdominals starting to burn a little bit, those muscles really kicking in. All right, let's bring one leg down and then the other, and then relax the abdominals. So we've got our core nice and warmed up here from a couple different positions. So we're gonna move and progress from here to a plank, which a plank sounds scary sometimes if you've never done one. We're gonna do a modified plank. So Brett will be on his hands and knees, kind of similar to the position he was in earlier, but his knees are further out towards his feet. So bring your, yeah. So we're gonna go onto forearms. He's gonna go down on his elbows. Yes. So his back is nice and flat. I want you to pull your belly button up and in just like it was earlier. And just maintain that position of the spine here. So again, he's on his knees, so he's not up on his toes. That's what we would call a full plank. This is a modified plank on the knees. Now you can modify it even further by bringing the knees closer to your body. Good. So this is still a modified plank position, but the knees are closer to the body, so it's much easier. And go ahead and bring the knees back out again, Brett. So this is the position I encourage you to hold if you're able. And again, listen to your body. Okay, the other thing I'm going to correct is Brett's neck. There we go. So sometimes people tend to let their head kind of fall down towards the table, or sometimes they want to extend it back up towards the ceiling. And you really want a neutral neck, neither way. So you don't want to extend your neck up. Your eyes should be directly down towards the floor. Go ahead and take a break and come out of this. Now Brett comes out of this by lying flat on his elbows, so he's getting some extension in the spine, and that's comfortable for him. So if that's comfortable for you, fine. You can rest like this. Or you can go back into a child's pose if your knees allow. And then arms out forward. Brett's a little tight in the hips, so it's hard for him to do this one. So we'll call this a modified child's pose, okay? But this is a lot of compression on the knees, so sometimes this can be difficult too. Okay, so we're gonna go back into that modified plank, down onto the elbows, the knees are back. He's gonna pull that belly button up and in towards the spine and just hold that flattened position. It's really important for the planks that you don't let your back sag down towards the floor. It needs to remain flat. Come up a little bit more on the knees, Brett. He's fatiguing. And take a break. Very good. We're gonna do one more repetition of those. All right, let's go ahead. So you can also bend the knees. Can you bend both knees, Brett? Yes. So you can also bend the knees like this. Sometimes this position is a little more comfortable than having your legs flat. Either way is fine. Just remember to pull that belly button up and in and really maintain that neutral spine. Very good, and relax. Okay, so now we're going to move to a side plank. So we worked the deep abdominal muscles here in a front plank, and now we're gonna work the obliques on the side. So Brett's coming into this position on his side, and he's gonna prop up on his elbow here with the knees bent. He's going to lift his hips up towards the ceiling, just like that. The opposite arm I like to put kind of on the side, but it can really go wherever is most comfortable. And he's just gonna, you can go down on the floor if you need to for balance. Sometimes this is challenging for balance. So if you need to put that other hand on the floor to support you, that's okay. So we're gonna hold this about 20 seconds. Good, and relax. Very good. Give a little bit of a break. We'll stay on this side and then we'll switch sides. All right, another set on this side. Same position up on the elbow. We'll lift the hips up and hold. Now you should have that same abdominal contraction that we've been having this whole time, really pulling that belly button in towards the spine. Very good, and relax. Okay, let's flip to the other side. So same position on the other side. We'll work the opposite obliques. All right, so Brett's gonna lift his hips up and he's just gonna hold it. About 20 seconds here. And relax. Very good, and then we'll do one more on that side. Yes, this is gonna work, Brett brought up a good point. This is gonna work your shoulders as well on shoulder stability and strength. So you may be feeling that your shoulder is actually the one that is weaker than the abdominals. That happens sometimes. All right, let's do one more repetition on this side. Good, pull that belly button in, abdominals are tight. Good, and relax. Very good. Okay. So we're gonna move on from the core stuff, and I would encourage you to go back and watch the video from last week too, and continue reviewing some of these core exercises. It may be that you need to stay to the more simple exercises before progressing to something like a plank, because those are a little bit more advanced. Even though we did it modified, they're still pretty tough. So listen to your body and do what works best for you. So we're gonna move into a little bit of hip strengthening next. So a lot of times with low back pain, our hip muscles totally shut off. They're usually tight and weak at the same time. So it's good to stretch them out and get them nice and loose, which we'll do at the end today, but also to strengthen those muscles too, to support our spine. And the other part is that we have one glute muscle called the gluteus medius, which is kind of a little, it's on the side and a little up towards that hip bone. And that muscle oftentimes contributes to a lot of low back pain that radiates all across that belt line area. And so that's a really important muscle to stretch and get lengthened and then to strengthen, because a lot of times it's really tight. So we'll work on that a little later. But we're gonna move to some hip exercises next. So this is a TheraBand here that I have. If you've never used one of these, they're really, really helpful for progressing exercises when they become too easy. Just a little bit of resistance can make a big difference. So Brett is gonna put this band on just so that you can see what it looks like. But if you don't have a band, don't worry. You can do these without a band as well. So this first exercise you may have done or heard of before. It's called a clam. So Brett's gonna go on one side. We'll do both sides. He's gonna keep his knees and his ankles together. He's resting his upper body and his shoulder on the mat. The opposite arm I like to put in front of the body for a little stability. And you should have that same abdominal contraction here. So he's gonna pull his belly button down and in, contract his deep abdominals. Now keeping the ankles together, he's gonna lift one knee up towards the ceiling and back down. So one common mistake for these is that the hip likes to roll backwards towards the wall, and we don't want that. So if you have a wall or a couch close to you, you could scoot up next to it so that it prevents your hips from rolling. But if not, that's okay. Just pay close attention that when you lift the knee up, the hip doesn't roll. Okay, so his hip and his low back are really still and stable, and he's just gonna go up and down at the knee. So keep going here. This is 3. We're gonna go to 10. 5, 6, 7, 8, 9. One more. 10 and relax. Good. So if you don't have a band, but the clams are too easy without the band, what you can also do is hold it at the top for about 3 to 5 seconds before you come down. So that what we call isometric hold at the top is gonna help activate those muscles a little bit more. If you're feeling that muscle work, then feel free to do it just as well without the band. So another 10 repetitions on this side. Good. So remember to keep that abdominal brace. Abs should be tight. This is number 4. This is 8, 2 more, 9, last one, and 10. Very good. All right, that was 20 total. So let's flip on to the other side. And we'll do 20 on the other side. If you don't have a band, sometimes more repetitions are also helpful to get those muscles really firing. All right, same thing on this side. Ankles are together. Hip is stable with the low back. The knee comes up. And his hips are not rolling here at all. They're really stable and still. But again, if you're having trouble keeping that pelvis stable, sometimes scooting up to the back of the couch or a wall will help. That looks really good, Allison. I lost count, Brett. 2 more. Last one. 10. Good. Take a little break if you need one. If not, you can keep going. Brett's laughing because he needs a break. Okay, go ahead. Another set of 10 here. Good. This is number 4, 5, 6, 7, 8, 9, 1 more, 10. Very good. And relax. Okay, those are the clams, so really good for hip strengthening. We're going to do another one that's similar to the clam. Now, there's 2 different ways that you can do this one. For those of you who may have watched Raul's low back class, I believe he did it a different way than we're going to do today. But either way, whatever's more comfortable for your body is fine. We're going to do it on hands and knees. So if you have knee problems, I'll show you the other way as well that might be more comfortable. But Brett's going to go on hands and knees here. And he's going to keep the band on just to show you what it looks like with the band. Okay, so his hands are right under his shoulders. His knees are right under his hips. And what he's going to do, keeping his back stable, nice and flat, his abdominals are pulled up and in, abs are tight. He's going to lift one leg out and back in. Now, it's not directly out towards you, towards the camera. It's a little bit out to the side, okay? So not straight out, but a little bit back behind you, kind of in a diagonal out from the hip joint. So the easiest way to remember this one is like a dog peeing on a fire hydrant. Okay, this is why this exercise is called fire hydrants, which is kind of a silly name, but it helps you get a visual for where the hip is going. Okay, is that about 5? So 7, 8, 9, 1 more, 10. Good. We'll go ahead and switch right into that other side. Same thing on this side. And it's pretty common for you to have one side that's much harder than the other. Your opposite leg that's not moving is having to really stabilize. So you're using a lot of muscles on the opposite side too. You may feel it on both sides. This is 8, 9, 1 more. 10. Good. We're going to go straight to the other side. If you need a break, you can take one. So one common, will you count for me in your head? Okay, one common mistake here for this exercise is that the hip rotates up and opens up towards the ceiling, and we don't want that. We want the hips to stay parallel towards the table, almost like you have headlights on your pelvis and they're facing straight down towards the floor. One more. 10. All right, we'll flip straight to the next side. You may be feeling it in your wrists a little bit too, so we're working on a little bit of wrist and shoulder stability as well. Good, so 10 more. Remember to keep your abdominals pulled up and in nice and tight. You should be feeling this in your hip muscles pretty quick. Two more. 10. Very good. Take a break there. Okay, Brett, you can take that band off. He's happy about that. Okay, we're gonna move into some stretching exercises. These stretches are really helpful to do both before and after exercise, but we're doing them after today just to kind of loosen up everything that we've been working on. So the first stretch we did briefly last session as well. It's called a piriformis stretch. There are multiple ways to do this one as well, but this is the traditional way I like to do it. So Brett's gonna cross one ankle on his opposite knee. So he's kind of in like a figure 4 here with his legs. Now, if this is comfortable for you and you're getting a stretch, you can stay here. Just push the leg out a little bit with your hands. And he's gonna push his leg out. Now, sometimes a pillow under the head is comfortable so that you don't have to lift the head up and you're not straining. So if you feel a stretch in this position, perfectly fine. If not, or it's a really light stretch, I want you to take the leg that's on the mat and lift it up towards you. All right, so sometimes we call this a figure 4 stretch. I call it a piriformis stretch. You should feel it in the hip musculature. So on this stretch position that Brett is in, he's gonna feel it on the side that the leg is crossed. So his left leg is crossed over his right knee, so he's feeling a stretch on his left side. Whatever side is crossed is the side you'll feel that stretch on. So about 30 seconds, he'll go ahead and relax. Why don't you scoot this way a little bit, Brett, so you can
Make sure it's in there.
relax your head.
Thank you.
You're welcome. Okay, go ahead and switch sides, opposite ankle and knee. So again, you can push out if that's comfortable for you. If you're not feeling much of a stretch, go ahead and pull the leg in. And still try and relax your head and neck on the pillow so that you're not straining. Okay, and we're gonna hold this about 30 seconds. So this stretch in particular is really helpful for that sciatic pain going down the leg. That sciatic nerve runs right through the piriformis, which is a muscle that we're stretching here. So loosening up that muscle can often help take some of the compression off that sciatic nerve. This should feel really comfortable. If it increases your pain at all, don't do it. It should be relieving for you. Go ahead and switch sides again, Brett. So really, anytime you're having low back pain, this is a good exercise to do. Anytime you're having that sciatic pain down the leg, this is a good go-to exercise. All right, go ahead and switch to the other side one last time. Good, and relax. Okay, 2 more stretches for you, and then we'll be done today. So the next one is a hip flexor stretch. This again is on the knee. So if you have knee problems, this probably isn't the best stretch for you, but I can show it to you in a different way too. We've done a lot of stuff on the knee today. Yes, hold on to the wall, Brett. Okay, so for this exercise, you're in half kneeling here. Before you lean forward like Brett is, I want you to tuck your tailbone like a dog tucking its tail. So you'll tuck the tail, flatten the spine, and then lean forward. That makes you feel a little bit more of that stretch in the front of the hip in those flexors. So sometimes a pillow or something under the knee is helpful for this so you don't have that pressure. So about 30 seconds here. And you don't have to go very far forward for this one. If your tailbone is tucked under and your back is flat, you may not go very far, but you're still gonna get a really good stretch. All right, let's relax this side and switch to the other side. Okay, so tuck that tailbone first, flatten the spine, and then lean forward. It makes a huge difference for this stretch. And it's more comfortable on the back too. So notice how Brett's back, his spine is totally flat. So his whole trunk has translated forward towards his knee. That's what you want. You don't want to be really extended at the back when you're stretching, okay? That's why we have you tuck the tail and lean forward. And relax. Okay, for time's sake, we're gonna go ahead and move to our last stretch, but it will probably be good to repeat that at least one more time on each side. So this is a foam roll. This is a piece of equipment that we use a ton in the clinic, and this is one of my favorite tools for back pain. this is pretty hard and firm. You can get them on Amazon or at any sporting goods store. I like your pink one there, Allison. Ours is white. It's not as fun. So anyway, so you can do so many different things with this foam roll, but I'm just going to show you one thing today that I really like, especially for the end of the day. You know, we all kind of sit in this posture here, which is not great for our back. So this stretch is going to get you out of that and stretch your thoracic spine a little bit too. So Brett's going to sit on either end, on one end of the foam, and he's going to lay back on it. So the foam is vertical here. Now you want the foam, you want your hips at the very edge of the foam. So scoot down a little bit more. You can't ditch that pillow. There we go. So the reason is that you want your head supported here. So if you have some cervical spine pain, one thing you can do here is put a pillow under the head or a towel roll, either way. That's going to flex up the neck a little bit, and sometimes that's a little bit more comfortable. So you don't want your head extended. You want it flat here. So all Brett is going to do is lay his hands straight out to the side and stretch, okay? Now, one thing to note here for the low back is your back should be flat on the foam, okay? That's why his knees are bent. So if your back is not flat on the foam, you can, by the way, if you don't have a foam roll, this is a great one to do just on the floor flat. Or you can also roll up a towel or a round pillow and put it in the same spot. You would just bring it up high, kind of on the thoracic spine, not on the low back, okay? So if you don't have a foam roll, just do it flat on the floor for now. But he's gonna bring his feet a little bit closer to his hips, kind of bend those knees a little bit more. So that helps flatten the spine. So make sure your spine is flat. Okay, he's gonna pull those abdominals in and get that abdominal brace just like he had before. Meanwhile, stretching out his pectoral muscles here in the chest. This should be really comfortable. It gets you out of that forward posture that you're in all day, and it just makes you feel better, okay? So we'll do some more things with this foam roll, but I just wanted to start or I guess end with this foam roll extension stretch here. You can do multiple things with the arms. You can bring them up overhead, just like that, and really get a good stretch in your thoracic spine. You can also do snow angels on the floor, on the foam, in this position here. Whatever you need to in order to get that thoracic spine. Here, you're fine. Need to move out of the way here. All right. So that is it for today. We will send out the exercises that we did so that you have those as well, and the recording. So feel free to review these exercises as needed. And then next week we'll progress the exercises and do a little bit more on the foam roll as well. All right. So I look forward to seeing you all next week.
Thank you.
No problem.